Hello, my name is Allie Bear. My group members are Danielle, Ocean, Azim, and Cecilia. Today I will be introducing the public health problem that we chose for our final group project. So to start off, we decided to do our project on the relationship between smoking and lung cancer in Hungary. Here's a little background information that we found important. 30% of Hungarian population smokes. There are 700,000 deaths a year in the EU. 31.5% of men smoke in Hungary, and that's as of 2015. Then for the deaths of men, 26.25% are caused because of tobacco. More than 26,000 people are killed by tobacco-related deaths. And then for females, 20.8% of females smoke, and then 13.98% of females die from tobacco-related deaths. Next, we have the overall financial cost of the problem. Overall, we found that the economic cost of smoking in Hungary amounts to roughly $1,567,437. This includes direct costs that are related to healthcare expenditures and indirect costs related to lost productivity due to early mortality and morbidity rates. Now I'm going to briefly touch on the ethnic and racial disparities. Racial and ethnic minority populations suffered disproportionately from tobacco-related morbidity and mortality compared to non-Hispanic whites. African Americans smoke fewer cigarettes and are more likely to be non-daily smokers than whites, yet they have an elevated risk of lung cancer. Hispanics and Latinos also smoke fewer cigarettes and are more likely to be non-daily smokers. However, lung cancer is the leading cause of cancer death among Hispanic and Latino men, and the second leading cause among Hispanic and Latino women.
Health behaviors, sometimes called health-related behaviors, are actions taken by individuals that affect health or mortality. In Hungary, the number one health behavior resulting in death is smoking. Out of roughly 2.6 million adult Hungarian smokers, more than 22,000 of them ages 35 and older died because of smoking in 2004. In addition, another 2,300 people died of passive smoking. Smoking is a major risk factor for a wide range of cancers, primarily lung cancer. The use of tobacco is one of the most important yet preventable risk factors for serious and often fatal diseases. According to a WHO study from 2005, smoking is the greatest risk factor for disability-adjusted life years for Hungarian men and women. Women lose about 15.2% of their healthy life years because of smoking, whereas men lose about 25.5%. Financially, tobacco-related morbidity and mortality can also be expressed in economical terms. Between outpatient and inpatient care, income lost by illness, and medicine, Hungarian lost between 315 to 330 million Hungarian forints due to health-related issues from smoking. This equals about 1.7% of Hungarians' gross domestic product. As for ethnic and racial disparities, in developed countries, availability of adequate food, housing, education, and healthcare is largely tied into social status. Likewise, socioeconomic status plays an important role on susceptibility to risk factors such as obesity, lack of exercise, and smoking. According to a 2001 Hungarian census, of the population living in Hungary, about 190,000 people identified themselves as Roma. The Roma population has proven to have a lower education level, socioeconomic status, and employment rate compared to the other Hungarian subpopulations. According to the Roma Health Survey, people living in the Hungarian Roma settlements have much poorer health than the rest of the country's overall population. This may explain their poor health status, but only partially explains their less healthy behaviors. While it is important to focus on the socioeconomic status, it is also important to note that the culture differences when developing a public health intervention. For example, Out of the Roma population, ages 33 to 44, half of them smoke within the first 5 minutes after waking up. This is a cultural belief that is not as common as with the general population of Hungary.
Azim just talked about and identified our health behavior problem. So now I'm going to talk about the Healthy People 2020 objectives. Healthy People provides science-based 10-year national objectives for improving the health of all individuals. For 3 decades, Healthy People has established benchmarks and monitored progress over time in order to encourage collaborations across communities and sectors, empower individuals toward making informed health decisions, measure the impact of prevention activities. Their vision is a society in which all people live long, healthy lives. So they say smoking framework for action to reduce tobacco use to the point that it is no longer a public health problem for the nation. So some goals we came up with after researching was to increase the price of tobacco products, enact comprehensive smoke-free policies, expand cessation treatment in clinical care settings, and provide access to proven cessation treatment to all smokers, implement hard-hitting anti-tobacco media campaigns, fully fund tobacco control programs at CDC recommended levels, control access to tobacco products, including e-cigarettes and combustible and non-combustible products, reduce tobacco advertising and promotion directed at children. Our overall goal is to reduce illness, disability, and death related to tobacco use and secondhand smoke exposure. This also came from Healthy People 2020. Thank you.
Individual factors that influence smoking includes the individual's knowledge of the effects of smoking and their social network. If the individual does not know the long-term effects of smoking, they'll never want to change their behavior since they don't see anything wrong with it. They also may surround themselves with people who either support or oppose their behavior. An individual's social network includes family members, a significant other, friends, and even coworkers. If their social network consists of non-smokers and even former smokers, they have a higher chance of quitting smoking. If their social network, however, consists of smokers, they have a lower chance of quitting since they are more surrounded by it. Environmental factors that influence smoking include manufacturing and marketing of tobacco products, specifically cigarettes, but also how available and acceptable these products have become for teenagers and young adults. In 2006, manufactured cigarettes accounted for 95% of total smoked tobacco sales. The modern cigarette has been engineered to promote constant buying and using of them, which helps sustain an addiction. If an individual sees their behaviors being accepted and promoting by these companies, this will influence them to continue their behavior, especially if they're of a younger age and their actions are permitted.
Due to the prevalence of smoking in Hungary, public health officials have came up with many interventions in the past. The first is the Hungarian anti-smoking policy, which is a policy that introduced a smoking ban in closed public places, workplaces, and public transit vehicles. It is also one of the most effective measures in decreasing smoking-related illnesses. This policy was found to decrease the prevalence of active and passive smoking and resulted with a considerably positive effect on several diseases, such as lung cancer, coronary heart disease, and stroke, to name a few. The quantified health outcomes are close to 1,700 deaths postponed and 16,000 life years saved annually in Hungary. The provision of smoke-free public places has an extremely positive impact on health of the public, especially in a country where a high burden of smoke-related diseases. Also, another significant intervention on tobacco use is raising taxes on tobacco products. In Hungary, regular tobacco tax increases resulted in decreased cigarette consumption, and it has lowered prevalence in multiple population groups. Raising tobacco taxes is highly effective in reducing the demand for tobacco products and consequently reduces smoking-related costs imposed on societies and improves population health. Higher tax raises additional revenues for the state budget. According to the World Bank, regular tax raises on tobacco products are the most effective measure to reduce tobacco use, especially among the youth and low-income smokers, i.e., the Roma population. This intervention has evoked many different reactions from the Hungarian smokers, such as smoking less, quitting for good, and some smokers changed to cheaper tobacco alternatives and products. Tobacco control policies are a proven strategy for discouraging initiation and denormalizing smoking. This strategy has an important potential for Roma communities due to their high rates of tobacco use. However, this study shows that the Roma populations are resistant to the efforts of limiting smoking. Changing these attitudes and beliefs will require targeted public health interventions that take into account not only the lower education levels of the Roma, but also their cultural beliefs in regarding tobacco.
The theory we chose was the trans-theoretical theory. This theory includes the stages of pre-contemplation, contemplation, preparation, action, and maintenance. The pre-contemplation stage is the stage where the person has no intention of changing their behavior, while the contemplation stage is the stage where individuals are starting to consider making a positive behavioral change. Our first goal with this project is to get the people of Hungary to move from the pre-contemplation stage, where they're not even considering stopping their smoking habits, to the contemplation stage, where they start to consider stopping their smoking habits. Their next stage is the preparation stage, where the person plans to actively make a change in their behavior within the next month. This is where we will start introducing our plan to the people of Hungary to quit their smoking habits. Next is the action stage, which is where the person has made measurable changes to their behavior within 6 months. This is where we will be seeing if our steps have worked and if there are areas we need to improve on. The next and final stage is the maintenance stage, where the person continues the behavioral change that they decided on. This is where we will make sure that the people of Hungary have stuck to their changes, as well as implement any changes we've made to improve the likelihood that the people of Hungary no longer smoke anymore. We will also be addressing the issue of temptation here and coming up with ideas to deal with temptation to ensure that the change is being held.
For our program, we're using the trans-theoretical model, and our program consists of reaching out to citizens in Hungary through social media and marketing within grocery stores or convenience stores, just basically wherever cigarettes are commonly purchased. We're going to be using social media and marketing tools to get people's engagement on Instagram and then also in store. Once we have collected enough participants, we're going to be offering a 3-month supply of free nicotine patches that will be distributed once a month through on-site locations. We'll also be having smaller doses offered each month of the nicotine patches, which will slowly transition participants through the hardships of addiction that cigarettes create. At the first meeting, participants will also be hearing from a speaker that has gone through lung cancer that was caused from severe smoking addiction, and we're also going to be having ongoing check-ins and prizes that will keep participants encouraged and on track. The first stage of the trans-theoretical model is pre-contemplation. So this is the phase in which a participant does not necessarily believe that they need to make a change to their behavior. They just know that there are options for change at this point. So in our outreach plan, this phase would include when people are going to the stores to buy cigarettes or when they do see our information presented on social media. And they'll be able to see what's going on and what we want to do for the community. The participants have not yet considered joining the program, but they're aware of what our mission is. The next phase is contemplation, and in our theory, this is when participants will begin to notice and read the information more in depth about our program. This typically occurs after a few times of seeing the information presented to them, and this is when they'll really start to think about making the change themselves. The third step is preparation. So this is the phase in which the individuals will actually sign up for our program through our online site or in person. And then once we have collected enough participants, we're using the number 50, we'll be giving them information about where and when our first location and meeting will be and what information they will need to bring and what information will be distributed to them. This phase is all about preparing themselves for the actual change in behavior. The next step is the action step, and this is when participants will be arriving at the first program session. They will have begun to start the action phase by making that commitment to quit smoking and signing up with us. They will then hear from a speaker discussing the hardships and negative effects of smoking, and then be provided with a monthly supply of nicotine patches with instructions and meeting times for the second program. At the second program meeting the next month, they will hear more information about why it is so important to stop smoking and the negative effects smoking can have on the body. They will be given their second month supply of nicotine patches that is a lower dosage, and then they will be given information of the next meeting, which will be the third and final program session, which will have the smallest dose of nicotine, and that is when we will tell them about the maintenance section, which is the next step in the theory. The final step, which is the maintenance step, is after the first 3 months when the participants have completed the in-person program sessions. Participants will be given raffle tickets for each month they complete check-ins and have shown their commitment to continue with not smoking. They will be entered into a monthly prize raffle, and after a full year of completing our program and checking in, they'll be given a $20 gift card, and their name will be presented through our social media with their story and what they have accomplished. We are hoping that through this model and our program, participants will be more likely to continue with their journey of stopping their addiction, and they will have enough of an incentive to continue working towards that goal.
We believe that our intervention will be successful because the steps that we have come up with are simple and concise enough to help with the flexibility between individuals as well as their individual needs, but also sufficient enough to help support each individual and the group as a whole to reach the desired results.